Infectious Diseases Unit at the Kenyatta National Hospital. Daktari, thank you for joining us again on Newsnight.
Hi, Maiga. Thank you very much.
Good. Let's get straight into it, Daktari. And I must say I've seen a few messages from a few Kenyans who are concerned today about the tone taken by Health CS Mutahi Kagwe. It worried them, especially when he said that the worst is yet to come. We have seen some good news in the war against COVID-19, but today's statement depressed a few. What exactly would the worst look like, Daktari?
Thank you for that question. I think it's a very valid concern. So to paint a picture of what the worst would look like, and maybe to try and imagine why the CS took on that tone and why even as Kenyans we need to be concerned. So the worst is a situation where we have uncontrolled spread of COVID in the society. And I know some people are probably thinking, oh, but COVID is mild, so we shouldn't be worried. Yes, most people have it mild, but there are those who get severe disease who require to be in ICU. And if you have uncontrolled transmission, then healthcare systems are overwhelmed. Doctors are overwhelmed. There's nowhere to admit people. There's no ICU to admit those who need critical care. It's a very worrisome picture. And I'm sure many people have seen what's going on in other countries. We do not want to get there. The reason to be worried, even though we felt that we're having some gains, is that when we start to pick cases in the community, when we start to pick cases where people have traveled, they've had so many contacts. I think earlier in the news I had one of the counties calling for people who'd traveled in a bus, traveled in a matatu, If all those people are exposed and you have maybe 50 people in a bus and each of them goes different ways and each has contact with 10 people, you can imagine how many people would be infected. And I think the reason for that concern is maybe some of us have been taking this lightly. You have seen cases of people doing whatever they can to defy the directives that have been put in place. And as long as we continue to do that, we are going to have more cases.
Okay.
So yes, it is a time for people to be concerned.
That's right. And of course, and this is a thought that many don't even want to think about, but that prediction by DG Dr. Amoth about potential of about 5,000 positive cases of COVID-19 by mid-April, that's end of next week, and 10,000 by the end of the month. Are those figures still realistic? And of course, tonight, what must Kenyans do to ensure that we don't get anywhere near that?
So the figures that were given earlier was really just looking at the trajectory of the cases we'd had. So you see, you sort of begin to model and draw a graph that says if we continue at the current rate, where will we be in a week's time, in 2 weeks' time, or in a month's time? And that's where those figures had come from, looking at the trajectory that we had then. In the last few days, there have been a few more cases than we had reported earlier, and the trajectory may potentially change a little. But that is also the worst case scenario where nothing is done to mitigate. I think it's within our power now to do a few things to make sure we don't get to that worst case scenario. But if things go on without people taking on any of those directives that have been given, then that is where we could potentially be headed to. So I think at this point, the one thing we can do to ensure we don't get there is, one, to stay at home. Because the disease doesn't come knock on your door and walk in. You meet it out there when you go around.
Okay. And I'm sure you'll be able to tell us a bit more even as we continue. One of the other updates that came out of that press briefing was the assertion by the CS that Kenya's positive patients have mainly displayed mild symptoms. Is there a scientific reason behind this, or is it just, some would say, good fortune or a blessing that the cases or the symptoms have only been mild?
So I think world over, that's a trend that has been seen, that about 80% of people who get COVID have mild symptoms. So they may have a mild fever, they may have maybe a sore throat or a cough, but world over, that's a trend that has been seen, that most people will have mild symptoms. So it's not really surprising that most would have mild. But having said that, we've seen cases of severe disease. We've even seen deaths in the country. So there's also the flip side of some people who get severe disease.
We can't say then that we are lucky or we've been fortunate as a country to have most of our patients with mild symptoms, then, can we?
I think it's early days. So we've only had so far about 172 as of today. I think a lot of the data we're getting are from countries that have had thousands of cases, which means they've had a number of cases from which they could say, so many present with mild, so many present with severe. So this is something that may evolve as time goes on. And we know that for sure we'll get some severe cases if what we've already seen is anything to go by.
Okay. And on a similar note, some would then ask, tell us a little bit about your thoughts about our recovery rate. 172 cases, I believe, is it 6 recoveries, if not a bit more? And how would you compare that with what's happening in other parts of the world?
So again, I'd say it's early days. We've only had this outbreak for now, probably just about 3 weeks or thereabout. We know that most people would take about 2 weeks to recover and to clear the virus completely. So over the next few weeks, over the next few days, we'll probably be seeing a lot more recoveries as more people reach that time point of about 2 weeks when they've potentially cleared the virus, so that when we retest, they are negative on the retesting. So over the next few days, I think we'll begin to see a lot more recoveries, because now we've had patients who've been in care for just about 2 weeks or a little more than that.
That is actually quite a positive update. Some of the questions that we're getting in, someone is asking, over the last 2 weeks or so, we have seen rainfall in some parts of the country. And, with rainfall and with sort of unpredictable weather, you might hear some people complaining of a bit of a cough, a sore throat. Some might be feeling maybe slight fever as well. What should that person do? Because that's a conversation, especially if you look on social media, people are confessing that they are feeling some mild symptoms. Should they be overly concerned?
So I think it's good to remember that COVID hasn't really replaced every other disease that used to be there. So we used to have sore throat, we used to have colds, and we used to have coughs before COVID came. So these have not gone away, they'll still be there. I think for now what we're saying is, if you've traveled, if you've had contact with a positive case, then you definitely need to be concerned, and you need to call, the call hotline number that's been given of 719. So you call that number and a team would come to you to assess and potentially take a sample from you. If not, and you have mild symptoms and you've had no contact, you've been sitting at home for the last 2 weeks or so since we were asked to sit home, then it's probably one of the other common what we call upper respiratory tract infections, things that affect the nose and the throat. So there you do usual home remedies, maybe gargle some salty water, take an antihistamine if your nose is a little blocked, and stay home. So if you're sick, you don't want to be jumping into a matatu to go visit someone, You don't want to be going to work. If you're sick, you stay home. Call that number if there's reason to be concerned because of contact, for example. But otherwise, you can take the usual home remedies.
Okay, so those panicking in the house, if they've listened to what you've said, can rest a little bit, effectively.
They can rest a little bit easier. I think one of the reasons maybe even why the CS may have taken the tone he took is, when we had few cases and we knew this one has traveled. So if they have symptoms, we need to investigate or test them.
That's right.
The problem is when you have a lot of people running around in the community with the disease, then it means defining contact becomes difficult, because someone may not know they've had contact, and that's why that cry to stay home is so important. Because if I've only been in my house for 2 weeks and I have a bit of sore throat, then it's unlikely to be COVID. But if I've been all over the place and I may have had contact, then you want to be a little more concerned.
Okay, thank you for shedding light on that, Dr. Let me immediately take you to a tweet by someone called Kenya Mzalendo. He says, please ask Dr. Ombajo to advise Kenyans that masks are not meant to be used as necklaces. And number 2, what does she think about the majority of masks in circulation, since they are not forming a tight seal with the nose bridge and with the face as well? So those are 2 questions. One, if you wear a mask throughout the course of your day, especially if you're working and if you're forced to leave your house to go to the office, can you take off your mask at some point? If you're alone in your office, can you put it down somewhere? Can you put it back on? Because we're seeing a lot of people hanging them around their necks throughout the course of the day. Just talk to us a bit about the best way to use those masks.
So one, that's a very good question because it's something that's very topical. Masks have almost become a fashion accessory for people. So it's important that we talk about how to wear it properly. So one, wearing a mask properly is important. At some point, maybe we'll get a chance to demonstrate how a mask should be worn. But one, cleaning hands, wearing well so that it covers the bridge of the nose and it goes under the chin is important. So we've seen people just covering the nose or pulling it down, lifting it to the side, just covering the nose. It needs to cover up to the bridge of the nose and under the chin, okay? And you tie it one above your head and at the back, the lower straps at the back of your neck. So the other thing is that wearing a mask does not replace other hygiene measures. So if you have a mask and you're not washing hands and you're touching things and touching your mask and touching things, then you're not really helping yourself that much. So it has to be taken together with the other hygiene measures. Masks serve two roles. One, it may protect you from whatever is in the environment, but it also protects other people from you. So for example, if I have a cold or I have a cough, it means that when I'm coughing or sneezing, those droplets are not going out and, contaminating surfaces. So it's helping you, but it's also protecting other people around you. So if you're out in public places, you're in the supermarket, you're in a public vehicle, wear it properly, let it cover your nose and your chin. If you remove it, you should clean your hands, because you potentially think that the outside may get contaminated. So it's not something that you wear, put in your pocket, remove, wear again, put in your handbag, remove, wear again, because then you're also contaminating other things.
But then, Daktari, logically,
clean your hands, all right?
How many masks would I then need for the average day? Because at some point you will take it off. And I've had a lot of people complaining that the masks are uncomfortable. For some, it's difficult to breathe in them. So realistically, how possible is it to do exactly what you're saying for an 8-hour sort of working day for someone who has to still go to the office?
So if you're on your own in your office or you're in your house, then you don't have to wear that mask. If you're in your house and you had symptoms, then wearing that mask is important to protect those around you. If you're on your own, then you can remove the mask. Remove it, clean your hands, and if you need to wear it again, tie it properly and clean your hands. Avoid touching it all the time, because if you're touching surfaces and touching your mask, then you're also contaminating your mask.
Okay, that's an interesting point. Let me take you, Dr. to our screen where we've put up some of the questions that our viewers are asking. There are very many, I must say. We'll try and go through a few of them in the time we have remaining. Sarah Mokam is asking, if a sick patient from the coronavirus cleans his or her hands and later touches my products that I am selling, won't that virus remain on the products? I don't know if you've gotten that.
So I think there are two. Yes, I got it. And there are two ways of looking at it. One, someone who has COVID-19 ideally shouldn't be walking around buying things. They should be isolated, right? So that's important. If someone, I guess the fear is, what if there are people there who don't know they have the virus? So that's where two things become important. That one, they wear a mask in a public place because that reduces the amount of droplets they're giving, but that they clean their hands frequently so that if they touch something, they are not contaminating that surface. So a lot of responsibility on us if we do get COVID, that we stay home or stay in the hospital or in a place where we can isolate appropriately. We wear masks and we clean hands very frequently.
But in the case that someone doesn't know and they go to your shop and they touch your products, even if they've washed their hands, is there a chance that they could leave some of the virus on your products?
So if they've appropriately washed their hands or appropriately sanitized, then they shouldn't leave anything on your products.
Okay.
But if they've washed and they're touching their face and they're touching this, then yes, they can. But that's why it's so important to clean hands frequently. If someone has a shop somewhere, they need to have sanitizer so that anyone touching their surfaces first cleans their hands. Wherever you're working, make sure you're cleaning your surfaces regularly to reduce the amount of contamination in the environment in which you're working.
Okay, thank you, Dr. for that. Let me take you to the next question. Bill Kerubo asking, I have someone who is a nurse and was due to retire in 4 years. She has immunodeficiency and is diabetic. High-risk staff have not been exempted from work. Why?
That's an important perspective, and I think it's something that should be taken up So because we know that someone who has high risk, someone who is diabetic, someone who is older, older than 60, and has other reasons to be immunosuppressed, should ideally be staying home, not being exposed. So that, I think, is something that is important to take up and to raise up with the authorities to say, consider your staff and say, someone who's immunosuppressed and is older should ideally be protected.
Can you almost go as far as to say that you cannot force that person to work if they have made it clear that they have a challenge with their immune system, for example?
Yes, I think if they've made it clear that, these are the challenges I have, I am diabetic, or I have HIV that is not well controlled, or I have some other reason to have immune deficiency, I think it's important that they talk to the people they work with so that that can be considered.
Okay, thank you. I hope that viewer has gotten some of your feedback. Masharifa is asking, when one tests positive for COVID-19 and is kept in an isolation center until he or she tests negative, is there a possibility that the patient may be a carrier of that virus without being positive or without showing positive signs of that virus when tested?
So what happens is if someone gets a virus, they shed the virus from, the airways, so from the throat, the mouth, the nose, and any droplets that come out. Once symptoms resolve, then there's less virus. And after a few days after symptoms resolve, when we test, and the testing is a swab of the throat, through the nose and through the mouth, we test and we don't have you don't have virus. It means at that point that you're not shedding virus. So if we do not detect virus, then you're not going to shed virus. And that is what we know for now. I think this is one of those things we say it's a new disease and we're learning every day as time goes along. But if you're not detecting virus, then you're not infectious to others. And that's why once someone is better and we do the testing, we say you're negative and can be discharged from a facility.
Okay, thank you for responding to that, Daktari. Mercy Wanga is asking, Daktari, for how long is the coronavirus viable, or should I probably say alive in a dead person? And secondly, they're asking, do we have standards for masks or any can do? So those are two questions.
So in terms of how long it remains viable, I'm not sure I have a good answer for that. But we know that the virus can remain on surfaces for several hours. So it's probably correct to assume that the virus will remain viable for several hours, maybe even longer. I haven't seen exact data on that. And that is why the issues around how to handle bodies have come up. That, if someone dies, the people handling that will, put the body in a body bag and decontaminate it. And people are asked not to handle that body at all, and also to bury within about 24 hours, just to reduce the potential for any contamination or transmission of infection to other people.
Okay, I'll skip the question about masks because I think you have taken quite some time to answer it. Someone is asking, and I think you've tackled this before, reinfection. What data do we have? How possible is it for you to have had COVID-19, be declared negative, and then get it again? This is from Julian Roa.
So from what we know of many viral infections is that often after someone has had an infection, they tend to develop some immunity. And we expect that that may be the same with COVID. But as I said, this is a new virus and we're sort of still learning more about it. So the issues around how much immunity develops and how long it would last is still something that's being studied by various groups. So for now, what we're saying is because we still do not know, even if you had COVID, don't now come out and just roam on the streets thinking, now I'm well. We still don't know whether you could potentially get infection. Indications are that people may develop some immunity, but how robust that immunity is yet to be defined.
Clearly, still a lot to learn about this virus. My last question, which is two in one, what's the latest about how long the virus stays potent while in the air? Because there's been a big discussion about whether it, how deadly it is when it's airborne. And finally, help us predict, Daktari. A lot of Kenyans are beginning to ask themselves, how long are we going to be in this state for? If I had a function that I wanted to hold where people must come together, should I plan to hold it in July, September, December, or early next year? Let's wrap up with those two questions. One, the airborne nature of the virus. And finally, for any Kenyan trying to plan for the future, you know, of course, once we've dealt with COVID-19, realistically, when should they plan for, from a scientific perspective, Dr. Go ahead.
Yeah. Okay, so the issue of being airborne, I think, has been subject to a lot of debate and a lot of people coming up with all manner of experiments to show how their breath has, you know, put off a flame or something like that. So this is something that some of the initial experiments that came out actually were very controlled. You know, they used something that we say aerosolize, you know, make something into very tiny fragments that can persist or be suspended in the air. So those are very controlled experiments. What we know is that most of the droplets that come out when someone is speaking are fairly heavy and they land quickly, which means if you're 1 meter away from somebody, then that shouldn't treat you. But if you're closer, then we need to have what we call the N95 mask, you know, the ones that healthcare workers should be wearing because they get very close to patients. The other studies of whether it's potentially airborne, at this point we do not have good reason to think that it is airborne. Because again, with airborne things, control is a little more difficult because simple social distancing may not work. But in this one, social distancing seems to work. So we think that it doesn't have potential to be airborne. However, if you're very close to someone who is coughing, then they may have a bit of aerosol that someone can take in. That's why we're saying keep your distance from people.
Okay, and the last
I guess
question.
The other
yes,
question
go ahead.
Was around how long should we expect this to last. So again, from issues of modeling, you know, modeling takes the data that we have and says what is the worst case scenario,
yes.
You know, and also looking at how other countries have had this go on. I think the best example we have is China. China put in very stringent measures. People stayed in their house. You are not to be found on the streets at all. So, and because of that, they were able to contain this sooner. How long this lasts depends on what we do. If we do not stay home, if we do not follow the directions that have been given, then we're going to be in this for a long time. Worst case scenario would possibly be that it would be towards, you know, September or October. That means if you have a big function, you probably want to plan for it early next year, you know.
My goodness.
But if we do everything that we've been asked to do, if we stay home, if we put in those things that we've been asked to put in to mitigate, stay home, wash hands, wear your mask when out in public, avoid social gatherings, then we'll beat this sooner. But I think, speaking to all Kenyans, the loss that we have now is nothing compared to the loss that we would have if this outbreak was very big. So we just have to persevere a little. We just have to follow this instruction so that we have a chance of getting back to our ordinary lives sooner.
But Dr.
You know, what I've learned over the last few weeks...
Go ahead. Yes, what you've learned?
What I've learned over the last few weeks working with people in, you know, the hospitals and all is everybody is trying to beat the system, you know. Or today I've seen videos of people trying to find routes to beat the ban on travel. People are finding all manner of excuses to be out. Let us stop doing that. If we continue finding reasons to be out there, we'll be in this for a long time. Please, let's help each other. Stay home and do everything we've been asked if we hope to return to our lives sooner. I know people are complaining about loss of business. We're all struggling with that. But you know what? It's better to lose it for 2 months than to end up losing it for a whole year.
Okay.
So let's try and work together on this.
I know I said final question. This is really the final question. You've alluded to people going back to a normal life. But let's be honest, Dr. Let me ask you this. Before we get a vaccine, or before we get this concept of herd immunity, where so many Kenyans have now gotten over COVID-19 that it's safe for us to move around, can you really say life will go back to normal anytime soon, even if we have COVID-19 under control?
I think the concept of normal is a difficult one to define right now. I think even if we have it under control, we'll still continue to talk about issues of social distancing.
Okay.
We'll still want to avoid large gatherings. It will probably be a while before we can say, let's go have a wedding, you know, let's go have a funeral with hundreds of people. That is going to take a bit of time. And maybe you mentioned this issue of herd immunity. So where, you know, most people have gotten infection, they've developed some immunity. And I mean, people wonder, why then don't you just let everybody get the infection and then we'll all be immune? But remember, there are those who get severe disease and there are those who die. So it's very difficult to allow it to go uncontrolled, and we just have to make sure we contain where we are. And that issue of staying home and not trying to beat the system is so important.
It's very important, Dr. Thank you so much for sharing with us hope, but also some sobering thoughts as well. Stay safe. We know you're very busy at this time, but thank you for speaking with us here on Newsnight. Dr. Loice Ombajo, University of Nairobi infectious diseases specialist and also head of the infectious diseases unit at the Kenyatta National Hospital, taking time to speak with us tonight on Newsnight. We've tried to go through as many of your questions as we can. We know you have many more, so we'll keep inviting her on the program. So please, as always, keep it Newsnight. My name is Wahiga Mwaura. On behalf of the whole team that's made this broadcast possible, and of course, my sign language interpreter tonight, Wilson Mushora, thank you so much for tuning in and for all your feedback as well, and the hashtag on the hashtag Newsnight and via SMS. Have a good night. Have a safe night. God bless.